Hello, I'm Nikki Herriott, Chief Executive Officer for Northern Territory PHN. Welcome to our new CEO monthly message video where I'll be sharing with you some of our recent achievements as well as our plans and activities for the months ahead. NTPHN is a not-for-profit organisation that is funded by the Australian Government as the Territory's primary health network to identify and address local healthcare needs. We work in collaboration with our stakeholders and regional communities to commission a range of comprehensive healthcare initiatives across the NT. As the Territory's Rural Workforce Agency, we also recruit, educate and retain a professional medical workforce. This month, we have been running events and consultation workshops that reinforce our organisation's values of relationships and results. Recently, we collaborated with Northern Territory General Practice Education to host our first education and training event for GPs, nurses and allied health professionals in Alice Springs. Known as Pop-Up PHN, this will be the first of several continuous professional development events we will hold in key locations across the NT. They will ensure health professionals working rurally and remotely have access to training and networking opportunities and an occasion to identify and address local matters. Our council meetings, including Top-End Clinical, Central Australia Clinical and Community Advisory, were all held in February. The Top-End Clinical was pleased to welcome invited guests Dr. Tony Hobbs, Deputy Chief Medical Officer, and Ms. Deborah Toms, our Chief Nursing and Midwifery Officer. They are both from the Australian Government Department of Health. Dr. Hobbs and Ms. Toms were keen to hear about clinical issues in the NT. Our Executive Manager of Planning and Performance, Serena Rudiger, and Workforce Strategy Manager, Lisa Sparrow, headed to WAGAIT Beach to meet with WAGAIT Beach Council, Department of Health and community members to discuss the local health system needs of the residents. A working group between all four stakeholders has been established that will review the feasibility of the residents' proposed requirements. NTPHN's Partners in Recovery program led a training and preparation workshop in Darwin for the NDIS transition across the Territory. The workshop was well received by the participants and helped to instil confidence for organisations involved in the rollout. The workshop was attended by various stakeholders including MeWatch, Mission Australia, Mental Health Association of Central Australia, Catholic Care NT and Team Health NT. We will be running more workshops in May and June. The After Hours program held 2 evaluation workshops in February, one in Darwin and in Alice Springs, which brought together partners funded by NTPHN that deliver after-hours projects across the NT. The workshops were designed to introduce partners to NTPHN's approach to evaluation and to start applying the approach within their own projects. This was a good opportunity for participants to share information and experience of their projects and services more broadly. In June, we will be launching Health Pathways, an online manual used by clinicians to make assessments about primary care management and specialist referral decisions for patients with particular conditions. Health Pathways will provide NT health professionals with better integration and coordination of care while reducing the demands of inaccurate referrals to specialists. We will keep you updated with this soon. If you would like more information, head to our website ntphn.org.au and follow us on Twitter @NTPHN.